common symptoms of mold toxicity and also how this often shows up in testing. So hi, I'm Megan. I'm a nutritional therapy practitioner and functional blood chemistry specialist, and our practice specializes in chronic issues, including mold. And mold is often overlooked definitely in Western medicine, but also very much so in the holistic health space, unless someone's very well trained and has sought out additional training. I don't know of any programs that are actually teaching mold first and foremost and doing a good job on doing that. So when we talk about mold toxicity, we'll often see a wide variety of chronic issues that seemingly cannot be resolved. One of the really big ones is mental health struggles, anxiety, depression, exacerbated. Even if you have a history of anxiety and depression, we'll often see this exacerbated. And how this will show up on testing is when we do an organic acids test, which is outside of blood work, our personal favorite when it comes to mold, really gives us a lot of good information. We'll see really often very low neurotransmitter production. This includes dopamine, serotonin, epinephrine, neuroepinephrine. The ratios of those as well will often show up really wonky. We'll often see, and not always, but oftentimes we will see high quinolinic acid, which is a neurotoxin, which impedes neurotransmitters from production, getting into the brain, doing what they need to do in the brain. So we'll see all of that come up. And oftentimes medication will not touch or very much touch this anxiety, depression, these mental health struggles that are coming up. We'll also see chronic gut issues, and this is because mold feeds gut overgrowth issues, and this is particularly true with yeast and fungus and parasites. However, we often do also see bacterial issues. If you have a history of H. pylori, SIBO, C. diff, other bacterial type of overgrowth that you cannot seem to get under control, if you have chronic UTIs, yeast infections, BV, like oral thrush, this white coating on your tongue that like no matter what you do will not go away, oftentimes mold is the root cause here. We'll often see histamine and or mast cell issues, and this can show up really differently for people. Rashes and hives are big ones. The other really big one is this like internal kind of itching that will come up where it's like you're itchy, but it feels like it's on the inside of your body and may not even present externally to something. You may notice that this is exacerbated in heat, or if you spend a lot of time in the sun, or after eating certain foods. This can also be a lot of nasal congestion, sinus issues, sinus pressure, sinus headaches, postnasal drip, just always having to clear your throat. So these will often come up, and we often will see different patterns, specifically oxalate patterns, come up in the organic acids test when this is the case. It's not perfect, but that is one of the ways that we can test and look a little bit deeper into this to get actually tested for mast cell activation syndrome. Very challenging. You have to be in an active flare. There are other ways that we can look at this and also address it without having to push you into doing that. We'll see blood sugar dysregulation issues. If you've got some weird blood sugar issues, even if you eat quite well and like fasting glucose is high, HbA1c is high, and or really low C-peptide, insulin, we'll see this on blood work. We'll also see this on the organic acids test and how your body's using fuel, whether that's sugar or fat. And oftentimes if we cannot use fat, if our body's not doing a good job of that, mold can be one of the reasons as to why that is happening. We'll also see some weird lipid markers. So if you look at your cholesterol markers and you're like, this does not make any sense, high or low, or just kind of some weird patterns going on, this is often how that will show up. We'll also often see energy issues. Do you have like extreme crashes in the afternoon? Are you just chronically fatigued all of the time, no matter how much you sleep? Do you also have sleep issues? Do you also have cortisol issues that you cannot seem to resolve, even when you're doing all of the right things to help support and regulate your cortisol levels? Hormones. This is sex, thyroid, and stress hormones. We will see these all out of whack. We can see this on actual Dutch tests. We can see this in blood work. Not the highest priority, but mold really impacts hormones. And if you have a lot of hormone imbalances or you're really struggling as you're entering into perimenopause, we may want to look a little bit deeper as to what may be contributing to that. And mold can be one of those big root causes. And the last one is weight gain. If you have unexplained weight gain in particular and you are doing everything right and just like it will not come off, now this can go back to thyroid, this can go back to sex hormones, but your body, when you have mold in your body, you're in a constant state of fight or flight, and you have to get the mold out, otherwise your nervous system will not regulate. If you suspect you have mold issues, we highly recommend booking a free consult with us first before ordering any additional testing. However, if you are going to order testing, we do recommend blood work first and then an organic acids test. We have a link in our bio. You can order functional labs through us at cost to us. There is an interpretation fee, but the lab itself is at cost. If you know you already have mold and you have the capacity to work with someone, I cannot recommend that enough. And work with someone who works with mold. This is really important because I see this addressed wrong all of the time, particularly with naturopathic doctors who are not well trained oftentimes in mold. However, this does really go across the board to most practitioners who do not specialize in mold. We do specialize in mold, and once again, book a free consult with us first before doing anything else is our recommendation. It is free.